Welcome to SDHC's Health and Wellbeing podcast. Before we begin, we want to emphasise that the information shared in this podcast is for educational and informational purposes only. While we strive to provide accurate and up-to-date content, it is not a substitute for professional medical advice, diagnosis or treatment. Always seek the guidance of your doctor or other qualified healthcare provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have heard on this podcast. Remember, your health and well-being are invaluable, so prioritise consulting with a medical professional for your personalised care. Welcome to SDHC's podcast this month with me, Dr. Nick Harvey, and our guest, Dr. Miriam Malak. Dr. Miriam Malak is the Clinical Director at SDHC, where she leads with a commitment to fostering better health and well-being today and tomorrow. Having pursued her medical studies at Southampton University, she returned to Eastbourne to complete her GP training after her father fell ill. Dr. Malak has a rich professional history, having worked as a locum and salaried GP before finding her home at SDHC, drawn by our welcoming atmosphere and shared values. During the pandemic, she completed a lifestyle diploma which ignited her passion for helping patients improve their sleep using simple techniques she discovered. Coming from a family with a history of insomnia, Dr. Malak understands the importance of restful sleep firsthand and is dedicated to sharing her knowledge with others. Beyond her medical career, Dr. Malak finds joy in her roles as a mother to 2 children, ages 9 and 13, and caring for her dog and 3 cats, alongside her husband. She enjoys engaging in sports like swimming, badminton and tennis, even if she admits she's not always the most skilled player. Additionally, she finds inspiration in the arts, particularly in drama and music. Having experienced the loss of both her parents in the last 8 years, Dr. Malak has faced various challenges that have reinforced her belief in the importance of caring for oneself and others. She believes that time is precious and advocates for prioritising a good night's sleep as a foundational aspect of self-care. Well, welcome, Miriam. Goodness, I'm exhausted just listening to that and how you've got to this stage in your career. And thanks for joining me today, and thanks for joining on SDHC in the broader aspect. So, I'm really interested. Well, I'm interested that your husband came last in that order, actually.
Yes, I think my poor husband probably feels that he might be slightly lower down the priority line, but it is okay. I love him very much, don't worry.
But goodness, I think that does reflect how much you juggle though, isn't it? And you must have quite a challenge in juggling that personal life and your professional life.
Yes. Firstly, thanks for having me here. It's lovely to come and speak with you. Sometimes I think we don't often have time to have these chats, so it's really valuable. As you say, yeah, life can be quite busy. I think a lot of working parents probably have the same issues, lots of challenges, but it can be really fulfilling, and actually constantly trying to work on that work-life balance, understanding what's important to you and what you need to prioritise is really important. And I think it's a daily, weekly struggle really, but when you get it right, it's great. It's great.
Yeah, thank you. And you really see it at work too, don't you? When everything, the balance is right, I think you're much more productive as one.
Absolutely. Absolutely.
So before we kind of go on to the topic of sleep, I'm interested then to follow up on that in terms of just understanding what challenges you most about your job but what do you love about it too? I think there'll probably be surprises, sadly, for me, even though we work together. Like you said, we don't get the time to talk. So yeah, what challenges you most and what do you love?
So it's been great working with SDHC. It's been a real challenge for me. The main thing is learning a lot about myself, really, and having the space to do that, being allowed to develop outside my comfort zone in a safe environment has been absolutely brilliant. Managing people has been new to me. I've done the medicine, but actually spending time trying to bring the best out of those around me, trying not to shy away from challenges that aren't just medicine has been brilliant in building me up as a person myself. I love the diversity of it. I love seeing patients, but I also love having the trainees with us, and I love the diversity in what we do in helping out with the vaccination clinics, doing clinical governance, and just spending time with people, really.
Thank you. And listening to you now, and also observing you with patients and colleagues, you strike me as really confident. Is that true?
Not 100% true, really. I think, as with so many people, I do struggle with self-confidence. And often when I go into something new, I'll often think, am I the right person for this job? Can I do this? But what's been really refreshing about my job actually is that time and space people give to encourage you. Yes, if you're not doing something quite right, that will be discussed, but in a way that will help you improve for the future, see what you can do better. And that has been improving my confidence. And actually, as things happen in your life, they can knock your confidence as well. You've discussed the death of my parents, anything, any challenges people have can knock your confidence. But actually, what's been great about the family here is people giving you that space and putting confidence in you to do things that you may not have had confidence to do yourself.
Thank you. I ask that because it strikes me that a lot of people, when we look at people, we often think they look confident externally, don't we? And I think the same goes for patients, isn't it? And they think, it's all very well, you can manage your sleep, but I don't have the tools within me. So it's not dissimilar, is it? I think probably to what you need to do with patients to try and kind of build that inner confidence to be able to tackle their problems.
Absolutely. And it's allowing someone the space in a similar way to what I was describing with myself, but allowing them the space to actually take that on themselves, giving them the tools to have a good night's sleep, their education to understand it. Again, I think a lot of what we do is giving people the knowledge, the background knowledge to help them to understand. And also just understanding that lots of people have the same problem can be quite empowering because you understand you're not in it by yourself.
Mm-hmm. Yeah. Thank you. People listening are probably dying to get to the nitty-gritty, so I'll move us on. We've touched on why this topic is of interest, and I know that you've had problems with sleep yourself and your family, but there must be other reasons. My dad will hate me for this, but my dad had hemorrhoids. I don't specialise in hemorrhoids. So why have you chosen this topic as something that, is your passion?
I have struggled with my sleep for probably as long as I can remember. And I've also seen it in my daughter, who's very similar to me, and also with my dad, who is very similar to me. And we are what you would call night owls. So we are natural. If you put all my clinics in the middle of the night, I would be a very happy person because I'm most awake in the middle of the night. And it doesn't matter how much sleep I've had during the day. Sorry. It doesn't matter how much sleep I've had if I've had a really bad night's sleep before. If you were to let me be in my natural habitat, my brain just wakes up. And I used to do all my revision at uni, 3, 4 in the morning, because that's when I was most awake. However, our world is not geared towards that. So I haven't put to you that, can I have a clinic at 3 in the morning? But I'm suspecting that you're going to say no to that. So it means that we have to find ways to adapt to the society that we live in. And actually, in doing that, I've become more productive as a person, much happier, because actually lack of sleep can affect your mood. It can affect your memory. It can affect loads of things. And actually, so it's really important to me that when I started implementing these techniques on myself, and I found that they worked, and the number of patients that I see with the same issues, not necessarily because they're night owls, there's lots of reasons why you might not be able to sleep. I just felt really passionately that actually it's a really satisfying thing to be able to help someone with something that affects them so much. And I was finding the medications, etc., weren't really doing the job. A lot of them have side effects. And so if there are simple things that we can do to help people that can have an impact on everything in their life, then why not? Why not?
Absolutely. Well said. Thank you. So what I wanted to do now is just to kind of set the scene so people know what's the one take-home message, especially maybe to people who know someone with insomnia or even a doctor listening or nurse. What's the one take-home message then that you think you'd like people to come away with from today's podcast?
I think it's don't be disheartened by struggling with your sleep or your patient struggling with your sleep. Don't feel that heart sink that actually, there's nothing that can be done. Think outside the box. Think of ways that actually you can structure a plan around, and that with most people, not everyone, but with most people, there will be ways to improve sleep, even if it's not 100%. They've had 9 hours good quality sleep. There are ways to improve it.
Right, thank you. So there's something around being positive and keeping on searching and thinking outside the box and maybe seeking help from someone like yourself.
Yes, exactly.
Are there any tools that people can use if they don't have that kind of access to someone like yourself?
So my understanding is actually that the Sleepio app, although I haven't logged onto it myself yet, is that what you were referring to?
Or just, anything, I guess. Yeah, not specifically Sleepio. Well, that's interesting, isn't it? Because it's just been approved by NICE,
yes, it has,
so it should be available to everyone.
Exactly. So it's something I definitely recommend having a look at, although I haven't logged onto it myself yet. But tools as in, so if we start with sleep hygiene, so these are very simple techniques that you can start with. Firstly, your bedtime routine is extremely important. So that hour before sleep, if you are struggling to sleep, so this isn't for everyone, because often people will say, oh, well, I don't have a bedtime routine and actually I sleep fine. Well, if you sleep fine, don't worry about it. But if you're having trouble sleeping, that hour before sleep is really, really vital. If you're spending a long time, say, watching really exciting thriller movie before going to bed, or even reading a really, really exciting book before bed, those thoughts, etc., can go around in your mind and not lead to restful sleep. Trying to have that period where you dim the lights a bit, that you start relaxing before bed, have a little bit of a routine, whether that be, take a bath, read a book, but nothing too exciting, whatever works for you. Doing that just before bed every night can be really, really helpful. And it can take time for your body to get adjusted to that routine. So don't expect an improvement straight away overnight, but these things can really help. If you are someone that finds that your thoughts are going through your head a lot, putting the day to bed, we call it, can be really, really helpful. So before that hour, if you write a list of maybe even 3 things of good things that have happened that day, and then 3 bad things that have happened that day, because sometimes we focus on the bad. So it's really important to write some good things, to focus on the positive, and then perhaps writing a list of things to do for the next day so that they're not going round your head. And that's what I call putting the day to bed, and can be a really helpful way of just putting everything down. You might know that the first line treatment for sleep issues is actually cognitive behavioural therapy for sleep. And there are some simple techniques that even if you're not seeing someone officially for CBT, that can be helpful, such as writing down your thoughts. So if you've got something that you're worrying about, we've talked about putting the day to bed, but if you've got a particular thing that you're worrying about and it's going through your mind, if you just think about it in a way, there's a little algorithm that you can use. Think about it in a way of saying, is this thought important first? And you say yes or no. If it's not important, if it's not going to have much consequence, then you can say that's not important and put it down. You can write it on your put the day to bed list. If it has got consequence to it, if it is important to you that day, if it's going to make a difference, then just think, is that something that is there something I could do about it right now? If the answer is yes, then you can ask yourself, is it going to be better if I do it tomorrow? if I do that thing tomorrow, am I going to have a better outcome if I do it tomorrow instead of now? If the answer to that is yes, then put it on your list to do tomorrow. If the answer is no, if the answer is no, then obviously, sorry, I've lost my track with the algorithm, but if the answer is yes, then put it on to do tomorrow. If the answer is no, then do it now. And that's it really. So it's about trying to track your thoughts and making a structured plan with what you're doing rather than just letting them go through your head in that way. I could go on about it forever, Nick, but there's things during the day as well. You might have heard that caffeine as well is a stimulant, a drug that we use freely and all day if we like. But actually this drug, caffeine, which is, I drink coffee as well and tea, but this drug is a stimulant that we're putting into our bodies, and it has a half-life 5 to 6 hours. And that means that it can stay in our bloodstream. Half the amount of that cup of coffee will still be going around your bloodstream 5 to 6 hours later, and that will be keeping you awake. And obviously this varies from person to person. Some people might metabolize it very quickly, and some people might metabolize it slower. And you always have that one person that says, well, I can swig an espresso just before bed and I'm absolutely fine. But again, if they're fine, then let them do what they want to do. But if you're not fine, then it's worth keeping that caffeine before, 1 o'clock. Have it before 1 o'clock in the afternoon, because if you've got half of that going around your body 5 to 6 hours later, then you've still got a quarter of the cup going around your body 10 to 12 hours later. So it's important to bear that in mind as well. I'll stop blabbering on and let you ask another question.
No, I'm fascinated. I'm hypnotized by. Thank you. And what you're making me think there is that actually there's many little changes that often need to be made rather than, it's a marginal gains almost.
Yes. Yeah, absolutely. That's generally how it is. And I think it's important. Obviously, each case is individual. So this is general advice, not specific medical advice. But, sometimes though, it can take, you'll be surprised, how much coffee people can drink or what caffeine is in. Don't forget caffeine's in Coke, in hot chocolate, you can get in ice cream, lots of things. So obviously Red Bull, I think, has caffeine. So sometimes people aren't even aware that what they're drinking. So getting that detailed look at what you're actually taking in can be really important. And I did a lecture, I think it's a couple of years ago now, and it was just about sleep and these specific points. And one person actually, all they did was cut down their caffeine, and they went from sleeping 3 hours to sleeping above 7 hours. So it might be for that person, it's just the one thing that they haven't quite thought about, but usually it is lots of little bits. And actually other things can affect sleep as well. So if you've got other medical conditions, if you're in pain, all these things can have an effect on sleep. And that's why it's important to tailor it to the individual in front of you, and thinking outside the box for sure.
Mm-hmm. Thank you. What I'll do is we'll take a little step back and maybe follow up on some of those things in a minute, and just change tack a little bit. So why have we chosen sleep? I mean, I think it's pretty common, isn't it? What are the stats? Do you know?
Yeah, so about a third of people struggle with their sleep in their lifetime. Or actually, I think that's at any one point, a third of people will be struggling in some form with their sleep. And actually, as we go through life in our different periods, so we might know if anyone's got teenagers, for instance, that their circadian rhythm, their rhythm of when they're awake and going to sleep can change. So they naturally want to stay in bed a lot later, because that's what their rhythm's telling them. And again, if the schools started a bit later, that would actually go in tune with their body clock, if you like. But again, society doesn't work like that. So it's important we find ways of getting around it. And as you get older as well, our sleep hormone that we produce is a lot less. And so that most people will start to realize that their sleep patterns change as they're older, might be sleeping less. So it's something that even if you're not struggling with at the moment, you might have periods in life where you do struggle, or if you suffer a bereavement or other things going on, other stresses in your life, most people will struggle with their sleep at some point, whether that be a short-term thing or a long-term thing, or if you've had kids, babies, whatever it is, our sleep is really important to us. And most people will have struggled at some point.
Mm-hmm. Well, 1 in 3 people at any one time. That's hugely important. And it has so much effects on people's health, isn't it? So it's interesting listening to you, because obviously sometimes it's just a primary sleep problem, but I guess more often than not, maybe there's something that is causing that sleep problem, be that anxiety, depression, pain, or whatever, as you mentioned. But you also mentioned the sleep hormone. Do you want to expand on that?
Yeah. So melatonin, for instance, is the main one that we think about when we think about sleep. And it's really important that we do everything we can to keep our level of melatonin high for when we go to sleep. And actually things like being in the daylight can reduce our melatonin and can make it more difficult to sleep. And back before, all our electronics, or, when we were, I don't want to say cavemen, but when we were cavemen, okay. So our body clocks were very much running by the sun, and we would go to sleep when it was dark, and we would wake up when the sun came up, and that's how we were. And actually we'd be in the natural rhythm of that. But nowadays we've got, we're in offices with lots and lots of light, and we've got our computer screens with lots of blue light again, which can affect our melatonin. And actually that can mess with our cycles. So it's important. So often we come home as well, and then we've got all the lights on and the TV on and everything before bed. And that, if you're struggling to sleep, that can have an effect on you. So being aware of that, and that's why we talked about dimming the lights before bed, making sure you get into the daylight during the day, that we're not just in a dim light office or whatever it might be, that you're getting out, that you're seeing the daylight, will help that whole natural cycle.
Mm-hmm. Thank you. And what about, because some people just don't seem to need much sleep, do they? I always think of Maggie Thatcher, and whether you think good or bad of her, she was an incredibly productive person, wasn't
yes.
she? And she famously slept sort of 4 hours a night. Is that all right? Is it not? What are your thoughts?
I do believe there is variation in people. However, I strongly believe that we do need a bit more sleep than that. And I used to be one of those people. So I used to say I need about 3-4 hours sleep at night, because I hadn't handled my sleep very well at that point. And I was quite happy to study through the night and then go to lectures during the day and go for my run or whatever it was. But what I hadn't really realized is that I probably wasn't as productive as I had been. And it does have other effects on you. So your sleep is really important for things like memory, for restoration, for healing, for your immunity. They've done studies on people where they have deprived them of sleep. I know it sounds awful. Sounds awful to me. Deprive them of sleep.
It's torture.
Yeah, exactly. And then like measured their white cells and everything in the body, and they've seen that their immunity has lowered. It has an effect on your eating. What we know that if you don't sleep, then you go for the carbs and you want to eat lots of unhealthy things, because that's the way our hormones are regulated. So it has effects on anything and everything, and also heart health, on depression and anxiety. So I'm not to say never, because I never say never about anything, but I'd say the majority of people would need more sleep than that. And generally we say between 7 and 9 hours is optimum.
What fascinates me is that I think, like, it's obvious if you're really tired and you're nodding off that you need a bit more sleep. But I think in most people it's a bit more subtle, isn't it? So like you said, maybe your memory's not so good, maybe a bit shorter, maybe you're not as productive at work, and you don't necessarily notice these things.
No. Exactly. And I think that is the variation. And you can become accustomed to something. If you don't get much sleep, then you become accustomed to not getting much sleep, and your body adapts to that. But I do think that there are consequences to that elsewhere, as we've said. And actually, if you are one of those people, then there's no harm in trying to get more sleep and seeing how that affects you. But everyone has their way and everyone's an individual, and so it has to work for them.
Yeah. I find it interesting too, when I talk to some patients who say, well, I sleep 6 hours, but you think actually over the period of a week, you've lost a whole night's sleep, haven't you?
Yes.
If your need is 7 hours, for example.
Exactly. Yes. It really does make a difference. I actually had a brilliant night's sleep last night, I have to say.
I was so annoyed. I fell asleep. 2 days ago was the Aurora, and I fell asleep about 30 minutes before everyone texted me, so I didn't see it. But I had a lovely sleep.
Oh, good. Oh, that's I think that's more valuable, but maybe not. and that brings to the point, actually, that there will be nights. So a lot of sleep, we call it sleep hygiene, all those techniques that we talked about. And actually going to sleep, we try to say go to sleep at roughly the same time every day, wake up at roughly the same time every day, because all these things help your natural rhythm get into a rhythm, helps you get to sleep much easier if your body's used to that. However, it's not always possible. You might have going out to a wedding. There's loads of things that can affect your sleep. And so actually just getting back into those, keeping your routine and doing that, when you're going to sleep or getting back into the routine as soon as possible is really, really important.
Mm-hmm. Thank you. I'd like to try and touch a little bit on called pathophysiology. So the things that go wrong in the body to lead to poor sleep and as a consequence of poor sleep. And I think we've touched with them on those things, but have you got anything else to add to our conversation so far?
Yeah, I think that it's probably very complicated, but to simplify it a bit, I like to think of it as I'm going to get this wrong now because they all begin with P, but predisposing factors, precipitating factors, and perpetuating. Thank you. Thanks for rescuing me there. Perpetuating factors. So you've got, by predisposing, I mean, what's already there, what's in you already that you don't have any control of. So this could be your genetics. So like I said, you can see through my family line what we're like with our sleep. And I knew immediately after having my daughter, I was like, oh, she's going to be exactly like me. And she was. And that's not something that we can control. That is just us. Or it could be something like the fact that I see this a lot actually, that your husband or your wife sleeps in a particular way. They have to sleep with the TV on. That is also actually like a predisposing factor, because that's not something that's, something you can control with yourself. So I've tried not to start arguments about that in the past, that I don't want to cause rifts between couples, but often it's something that you might need to look at. And then precipitating factors is stuff that happens in your life. So like I said, a bereavement, or is there stress at work? And these are the things, that you haven't brought about yourself, but are there, and that can suddenly bring this predisposing factor, your genetics or whatever it is, to cause a problem with your sleep. So it's looking at those things. And then the perpetuating factors, I got that one right, didn't I? Perpetuating factors. It's all the P's. And is things that will keep this going. So do you have a tendency to worry about things, to ruminate over your thoughts, etc.? And actually that's where things like cognitive behavioural therapy can come into play and help with those perpetuating factors. Those are the bits that are more, that can be controlled. If that makes sense. And
I think I might be completely wrong, but my ears pricked up earlier when you were talking about the circadian rhythm, and it fascinates me how so many disorders that we see are related to that, even if you go to asthma and things like that, isn't it? Are you able to expand a little bit on that? And
I think my knowledge is probably, I'm trying to think, they're fairly limited on that. But other than the fact that actually the way your hormones work and the way the rhythm of your body works, etc., is really, really important to get those things aligned so that you can sleep. Did you have any specific questions about? Sorry.
Well, I was just thinking about that, say cortisol. So cortisols are kind of stress hormone, if you like, isn't it?
Yes.
And it kind of dips at night. And
yes.
And that's why I think a lot of things like asthma, for example, get worse in the nighttime. And I'm thinking and you mentioned about immunity. We talked last time about inflammation maybe actually being affected by your levels of cortisol because of chronic pain, and this kind of real interrelation between trying to get more physiological, more healthy levels of cortisol by the way you act and behave. And I think sleep must be really intertwined in that normal rhythm of cortisol going kind of dipping at night and upping again in the morning.
Yes, absolutely. And that's why stress can have such a effect. Cortisol is the stress hormone, can have such an effect on your sleep as well. And all these techniques such as, mindfulness, etc., can help with those hormones.
Yeah, I mean, it's just, I think it's funny because it's really hard to get kind of scientific evidence sometimes for these things. And I'm not sure, either how much we can prove these links, but there's clear logical links between sleep and cortisol and stress, cortisol levels and I don't know, getting stomach ulcers, for example. So I guess what I'm getting at is to make listeners understand that the little things around sleep, the soft things that we might say are like, I don't know, pull yourself together over, to use a horrible old-fashioned term, are genuinely significant problems that I think we should treat just like a stomach ulcer or worsening asthma, that we can demonstrate can be linked to these kind of cortisol levels, etc., and things that we don't understand yet in the brain. I suppose that's what I was getting at, really.
Okay. Yeah, no, I agree. I think all these things, I believe there's so much that we don't know about it, basically, that actually all these things have an effect on us. All those things which you said, pull yourself together, etc., is actually important to make sure that we're dealing with those things so that the subtlety of them can have an effect on our sleep, which then brings about this cycle of actually that then having an effect on how we are, on our health during the day, etc. Because we know that inflammation, etc., goes up if you don't sleep well. We know that your immunity goes down if you're not sleeping well. And actually, the problem is if you don't break this cycle, then this can have an effect on us, increase in cancers, increase in heart disease, increase in all these things. And actually, that's why it's so important to sleep well and to get a handle on that. And to do that, you need to look at all these subtleties. I agree. Sorry, I didn't quite get what you were getting at for a second, but I'm there. No, it's my fault. I'm there now.
So I've kind of messed up the flow a little bit here because we talked a lot about the treatment options. So, and this is where I was going to ask you about them. So just to summarize what I've heard from you, because I think you probably have things to add, is that there's loads of things that you can do yourself, isn't there? And there's this Sleepio app. There's a load of websites around sleep hygiene and other techniques that can use. And it might just be getting the discipline or exploring with your loved ones as to what are the blockers to getting the discipline. You know, why don't you have motivation? A lot of, we say basic, but they're fundamentally important things, aren't they, I guess? And then if you're not getting there, I've heard from you that there's kind of insomnia CBT.
Yeah.
And that's something that's available, again, through the Sleepio app, isn't it?
Yeah.
As well as with somebody like yourself.
Yeah, yes.
Or through other methods. So how might you go? So let's imagine somebody is at their wit's end, doesn't know what to do, and they're sat in the front of their GP. What are the questions they should ask their GP to kind of unlock the right help for them?
First, it's really important to be completely honest with your GP about any stresses or anything that's going through your mind at the moment, so that they can explore things, because they're able to explore things like sleep hygiene, etc. I think it's important to have an open mind and not just think that it's the medication that's going to help you, because there's lots of cons as well with medication. It's not the be all and end all answer to everything. And as I said, CBT is first line. And you've mentioned the Sleepio app. There's Health in Mind in our area as well that can offer help with sleep. Some places do CBT, and some people run courses, so like self-help courses. So if you have a look on the Health in Mind website, you can see what they're offering there. Like I said, there's simple cognitive behavioural techniques that you can do, and some people prefer to read it in a book. So there's plenty of different things on Amazon and things you can have a look at there, providing obviously that it's safe for you to do that you're not getting to the point where you're literally at your wits' end. If you're at that point, you really, really need to be speaking to someone. I offer some brief CBT techniques in our clinic here at SDHC, and that can be very helpful as well. I will use alongside that the CBT I Coach, the app, which is helpful to record your sleep diary, etc. And it looks at things like sleep efficiency, which is about being efficient with your sleep when you're in bed, that you are in bed sleeping and you're not sitting there thinking about other things. So the questions really to ask are, where can I get CBT, which you can speak to your GP about, but those are the main resources that I could think of.
Thank you. If I put myself in the patient's shoes, I think, it's a bit of hard work, isn't it, CBT? I mean,
yes,
isn't there just some sort of quick fix I could have?
So the sad thing about this, the only sad thing, is that there is no quick fix, really. If you want proper sleep, there is no quick fix. Because so people think of drugs like Zopiclone, these sedate you. They don't give you proper sleep. You won't get the restorative sleep that you need. I'm not saying never. There are instances where it's important, after a bereavement, etc., you really can't sleep. Then sometimes just being able to sleep in itself is a helpful thing to do. However, it's not a quick fix, and you do need to put the time in it. And actually, even now, because I know my tendency is to be up during the night, even now, if I don't follow, if I go, it's fine, I can have that coffee at 5:00, I know it makes a huge difference to me. So it's something that I do have to work at, but it's so worth it in getting good sleep. And I think that's something you have to come in realizing, is that actually, if it is important to you, and I think it should be important to everyone, then actually you need to put the work in. But that also means that you have control of it, which is good. If you're the one putting the work in, you have the control ultimately, because these are techniques that you can come back to time and time again.
So you mentioned there, Zopiclone. So there's these drugs called Z drugs, isn't there, that are quite commonly used alongside things like diazepam or Valium and other benzodiazepines. But they're actually quite dangerous drugs, really, aren't they?
Yeah, exactly. They are, and they can be addictive. And like I said, they don't give you necessarily great sleep either. You don't feel necessarily rested afterwards, because they just sedate you in a similar way like alcohol sedates you. It doesn't give you good restful sleep. You might notice if you regularly drink before bed that can give you wild dreams and unrestful sleep. So in a similar way to that, and they can increase all-cause mortality as well. They're not great drugs, to be honest, and we used to give them out a lot more than we do now, and that's a good thing. That's a good thing that we're reining that in.
I mean, it frightened me as a prescriber when I learned that. So I just wanted to reiterate your point that you said about the Z drug. So if you take a long-term Z drug, you will, on average, die significantly younger than somebody who's not taking a Z drug.
Yeah.
And that's frightening, isn't it?
Yeah, absolutely. I don't think we don't always, because we can't possibly tell people all the risks every time we prescribe a medication, but it's important to read up on the medications you're taking. And I don't think that's one that's said a lot, actually, because can you imagine giving someone something and saying that, and then, I mean, it depends how desperate. Some people are very desperate for sleep, but.
And that's a challenge, isn't it, in our role, I think, as GPs, because I guess we just need to we really want to. And frustratingly, sometimes we just don't have the capacity as a profession, I think, to understand the problem because, like you say, sometimes it's really appropriate for a short-term use, isn't it? And we need to try and help people and reach a shared understanding between us and the person, I think, as to what really is needed. But especially in the elderly who suffer from more insomnia anyway, but yet are more likely, for example, to suffer a fractured, hip, aren't they? If they're taking the drug, falls, and die younger. So it's a minefield, isn't it?
It is. And it's definitely balancing that risk versus benefit, which is what we do every day in everything we do. But I'd just like to quickly say, though, if you are on Zopiclone or one of the other Z drugs, then don't stop it abruptly if you've been on it for a long time. Do make sure that you go and speak to your GP.
Thank you. Yeah. It's so easy to miss things like that, isn't it? And often, it is also the right thing. So I think this is about being balanced, isn't it?
Yeah.
And please do not stop suddenly your long-term drugs, or you'll get all sorts of other problems. But we can support people to come off them.
Yeah,
right?
Absolutely.
In a safe way. So that brings us to some other drugs, though, doesn't it? So melatonin is an old favourite. So why not give everyone melatonin?
Well, firstly, we can only prescribe it in certain circumstances at the moment, but because that's what our guidance is. So over 55-year-olds can try it for chronic insomnia. It is good in terms of for things like jet lag or circadian rhythm disorders. But again, as GPs, we are quite limited in when we can prescribe it. As in terms of new drugs, though, there is a newer drug that's come up that's been NICE approved called daridorexant. I think I pronounced that correctly. I still haven't had a chance to use it, though, so I think you have, though.
I've beaten you there.
Have you had any feedback about that?
No, he's still asleep. I don't.
Okay, but this is supposed to be a non-addictive drug, and it works on the orexin receptors in the brain, which are orexin is it affects the wakefulness, and it's supposed to have had really, really good results. But again, it's not something I've used so far, and there are limitations to this. It's not first line. You have to have had CBT. Either CBT is not available to you, or you've tried the CBT for insomnia. You need to have chronic insomnia for 3 months, at least 3 nights a week, and that's got to be affecting your daily life as well. So it's not for everyone, and there will be some scenarios where you might not be able to have it, such as if you've got narcolepsy. So don't go straight to your GP and expect it. Otherwise they won't be happy with us.
I'm slightly nervous about it because I suppose a lot of us are thinking, is that going to be addictive? But it doesn't appear to be, does it?
No.
Because it doesn't work in the way of these other drugs. So touch wood, it's not. But it's only actually had 12 months of follow-up at this moment, hasn't it? So we don't really know the long-term effects, do we? So I think we also need to be cautious.
Always need to be cautious with these things, yes. But they do stringently check these before they allow us to prescribe it. So there is reassurance in that. But yes, only 12 months follow up. So we're not 100% sure. And it's not to be used indefinitely at the moment. So, and if it's not working, then you would be coming off it anyway.
Absolutely. Yeah, always disappointed to hear. It sometimes takes many, many years to find out what side effects a drug has, doesn't it? Just thinking about omeprazole with limiting the absorption of things like magnesium, quinine, which was an old favourite. So I just wonder. So I think we're just almost, it's time to revisit that take-home message and kind of segueing into that, because your take-home message was around having a structure to tackle the multiple little things that might contribute to sleep. And that's so much more important, isn't it, than focusing on these drugs, which can help a minority of people very successfully.
Yes. And actually that's part of it, isn't it? I haven't had a chance to use it, but actually I hope that keeps going that I don't have a chance to use it, because actually if you can help people without the use of medication, then for me that's so much better.
Yeah. So at this time in the podcast, I tend to ask a question from the previous guest.
Mm-hmm.
And last time we were asked I was asked to ask you, right, so I've fallen to sleep really well and I wake up 2-3 o'clock in the morning and I cannot get back to sleep. How are you going to help me, doctor?
Right. So it's a good question. Thank you. So a couple of things which I haven't actually mentioned before is that your bedroom should literally be, I don't know if I can say this on the podcast.
It's past the watershed.
It's for sleep and sex, and that's it. Everything else should be out of the bedroom. And this is because your bedroom is kind of a safe sleep place. So watching TV and all that kind of stuff isn't helpful for keeping your bedroom that sacred place for sleep. So in relation to that question, if you're lying in your bed thinking about sleep and you're not getting to sleep, you need to get out of your bed, because then you don't want to associate the bed with not being able to sleep. And tackling things like sleep efficiency fall into that as well. So people vary on how long you should give it. I've heard between 15 and 25 minutes. So let's say 20 minutes roughly in your bed. If you're still awake, you need to get up and out of bed so that your brain isn't making that association with staying in bed and not being able to sleep. Don't time it. Don't look at a clock. Don't sit there and wait for 20 minutes. That is only going to make it worse. I say roughly 20 minutes, then get up and out of bed. Go and do something else. Again, nothing too exciting. Some people like to do a bit of their bedtime routine again. And then when you're feeling sleepy, and I mean sleepy, not tired. Sleepy is different to tired. Sleepy is when, your eyes are drooping and you're yawning. That's sleepy. When you're feeling sleepy, go back to bed. If you're not, again, 15, 20 minutes, if you're still lying there, get up. And what usually happens is what I've seen is that over a period of time, so you might be awake a long time the first night because you're not used to doing it. And like I said, the circadian rhythm takes time to get used to things and all those hormones we talked about and the intricacy of that. So it won't work the first night, but gradually that gets better. And you often find that people wake up at the same time every night, or that if something else has woken you up, you need to tackle that. So if it's that you're getting up to go to the loo, that you're in pain, those are things that you need to tackle as well, which you can speak to your GP about separately. But the main thing is that get up, do something else, come back when you're feeling sleepy. Don't associate the bed with not being able to sleep.
Thank you. That's a useful take-home message. So hopefully Caroline will be happy with that.
Hope so.
So on that topic then, in our next podcast, we've got Katie Day, who's coming to talk to us about the menopause. What do you want to ask her?
Oh, does that include prescribing an HRT?
Yeah, I think that's reasonable.
Yeah. Okay. So personally, I always get a bit nervous when ladies really, really obviously getting on really well with their HRT, and that's great, and they don't want to stop it at 70. That starts to make me very nervous. And usually I would encourage people to stop at that point, because in my mind, the risks outweigh the benefits at 70. And I'm just wondering what her thoughts would be on that, and if I should tackle it any differently.
Thank you. So should we stop HRT once they're 70? Thank you very much. I will make sure I quiz her on that, because it stresses me out too. Stresses me a little bit less than it used to, but I remember having quite pressured discussions.
Yes, yeah, and it's understandable if someone's feeling great. Why do they want to? Would they want to stop something that's making them feel great?
Yeah. So
it's really hard. So that'd be great.
Yeah.
Thank you.
And I think it touches on a bit like the question about Zopiclone, isn't it? And this real struggles I think that we have as GPs in having some responsibility for any outcomes that happen from drugs, isn't it? And it's really difficult, isn't it? Because
Absolutely.
I think we all come from a place of wanting to help, and that can sometimes lead us unwittingly and the person taking it into problems and creates a requirement on us to have some of the tough discussions too, doesn't it?
Yes. And actually if you give someone all the facts and all the side effects and all the risks, although we never know, we might not know all of them, like in these new medications we're talking about, then actually having an honest conversation about that. There are certain things that we definitely can't do, but sometimes having that honest discussion about the risks and benefits might be that the benefits for that patient is more so than the next patient, and that's why it changes those discussions.
Yeah. Thank you. Well, we should probably wrap it up there. Hopefully we're not boring too many people, but it's always a real pleasure to talk to you.
Thanks.
And it really gives me an energy once I come away with a conversation with you. So thank you for giving so much time, and I look forward to maybe another one in the future. Maybe about lifestyle medicine, something like that.
Yeah.
That's it.
Thank you, Nick. I really appreciate it.
Thanks very much. You've been listening to the Health and Wellbeing podcast about sleep with Dr. Miriam Malak and me, Dr. Nick Harvey. For more information and resources, check our website out, sdhc.org.uk. If you have any feedback or suggestions for future episodes, please email us at sdhc.feedback@nhs.net. Tune in to our next episode, where we'll be interviewing Katie Day to talk about menopause. Please take a moment to subscribe to help support us in supporting others with their health and wellbeing.